Hello, I'm Dr. Randal Thomas, Professor of Medicine and Director of the Cardiac Rehabilitation Program at the Mayo Clinic. Today I'll be discussing what you need to know about cardiac rehabilitation. First of all, cardiac rehabilitation is a medically supervised program to help people with heart disease recuperate and thrive. There are a number of components to cardiac rehabilitation, including exercise training, nutrition therapy, and other aspects including stress management, helping with smoking cessation, and a number of other treatment programs. Patients who participate in cardiac rehabilitation receive a number of important benefits as they receive these therapies. These benefits include improvements in cardiovascular risk factor control, improvements in physical functioning, how well they can do things, improvements in their mood and psychological health, and then perhaps even more importantly, reductions in hospitalization rates, recurrent cardiac events such as heart attacks. The numbers of recurrent heart attacks go down in participants in cardiac rehabilitation. And then finally, death rates over the subsequent years decrease in participants of cardiac rehabilitation. To illustrate how cardiac rehabilitation can be of benefit to patients with heart disease, let me explain a typical scenario or a typical patient example. We will often see a patient after a heart attack who comes into the program somewhat fearful of exercising, uncertain if it's safe for them to do so, uncertain how well they'll do in the future, if the fact that they've had heart problems means that their future is quite bleak. And as the patients come into our program, we help them to see how they can safely exercise. In fact, exercise is a key part to their recovery and good health in the future. But they also have medical supervision in helping them advance in their exercise program, make sure that they're on the right treatments, and as they do so, they gain greater confidence and hope for the future. So there's a number of important benefits that come to people who participate in cardiac rehabilitation programs. Because of these benefits, cardiac rehabilitation is strongly encouraged and recommended by the American Heart Association, the American College of Cardiology, and many other national organizations. Unfortunately, despite all of these benefits, and despite the fact that these services are recommended strongly, only a small minority of eligible patients typically participate in cardiac rehabilitation. There's a number of barriers that get in the way of people participating in cardiac rehabilitation, distance to a program, job and other demands, lack of insurance coverage, and most of the time it's for lack of referral or lack of awareness of the benefits of cardiac rehabilitation. Fortunately, there are new strategies that are being developed and have been developed to help improve the utilization and participation in cardiac rehabilitation programs. For example, there are automatic referral systems in hospitals that help to enroll more people into a cardiac rehabilitation program. For example, somebody gets into a hospital with a heart attack or with heart surgery, there's a system in place to get them enrolled in rehabilitation automatically, essentially. There are other programs and advances that are happening today, including home-based rehabilitation, smartphone-based options that are going to be even more exciting in the future. Well, today I've discussed a little bit about the importance of cardiac rehabilitation. For more information about this and other topics in cardiology, please click on the link below. Thank you very much for joining me today.